Hi, everybody. It's great to see you at this wonderful geriatric medicine town hall here at MGH. We're so happy that you could join us. My name is Sharon Levine, and I'm the section head of geriatrics in the Division of Palliative Care and Geriatric Medicine. There's a few housekeeping rules before we get started on this Zoom. All participants, get ready now if you haven't done this, are muted to eliminate any background noise. You can view the speaker on your full screen, or you can go to the gallery view in the upper right corner to see all the participants in our little Brady Bunch. If the picture becomes jumpy or out of sync, click Stop Video in the lower left corner to speed up your connection. We encourage you to pose questions using the chat feature in the bottom ribbon, but don't share personal medical information in the chat because it can be seen by everybody. If you do have a medical question, please reach out to your doctor directly. Today's subject, and I love it, is the medical misinformation morass: detecting fiction, deploying facts, defending science. That's a lot of alliteration. I think that's a very good title. We are covering a lot of information today, and we're grateful to those who posed questions for the speakers to address. We have excellent speakers joining us, and I'm going to introduce everyone now. And in order of presenting, we'll hear from Peggy Slasman, Adil Akhtar, and Matt Russell, who you all know is our clinical director of geriatric medicine and the medical director of ambulatory geriatric medicine. He'll help moderate the questions today. And let me just give you a little bio for a moment here on Peggy Slasman. For nearly 3 decades, Peggy Slasman served as the Senior Vice President for News and Public Affairs at Massachusetts General Hospital in Boston, overseeing media relations, publications, internal communications, and crisis communication. A member of the hospital's executive leadership team, Peggy helped develop communication strategy, working closely with the hospital president to write speeches, op-eds, testimony, and a wide range of executive communication. In addition, Peggy served as editor-in-chief of Proto, a national science magazine produced by MGH. She also oversaw the MGH's Paul S. Russell, MD, Museum of Medical History and Innovation, which she helped plan, develop, and open in 2011, and she led the creation of the MGH History and Archives program. Before coming to the MGH, Peggy directed the Public Affairs Department at Boston Children's Hospital, where she co-authored 3 commercially published books for parents. Peggy began her career as a journalist, covering science, medicine, health, and education at newspapers in Texas and Missouri, and a news bureau in Washington, D.C. Do you want me to introduce Adil also right now, or do you want to wait till we get there, Judy and everybody?
Introducing now would be great.
Okay. Adil Akhtar is an oncologist and a palliative care expert based in Michigan, where he serves as associate professor in the Department of Medical Oncology at Oakland University William Beaumont School of Medicine. He is also the chief of palliative and end-of-life care at the Michigan Health end-of-life care for the Michigan Health Professionals. Previously, he served as the chief of the Cancer Center at Beaumont Health. Currently, Adil is a master's candidate at the Harvard Medical School, where he is studying healthcare operations, focusing specifically on developing effective means of addressing medical misinformation. And he'll be followed by our beloved Matt Russell, who will follow him afterwards. So Peggy, I'm gonna pass it on to you. And thank you so much for joining us today.
Well, it's so great to be here, and thank you for inviting us. Adil and I are thrilled to be talking about our favorite subject. I've attended a number of these town halls in the past couple of years, probably 5, 6, 7, something of them. And I have to admit, my favorite one was with Yo-Yo Ma. This presentation today will not be quite as soothing, but I hope it's interesting. We're going to be examining the issue of medical misinformation and talking a bit about what it is, why it's so prevalent, how you can spot it, what's being done to address it, and what you can do to help. So let me start out with a definition of misinformation. It's defined by the CDC as information that is false, inaccurate, or misleading according to the best available evidence at the time. And I want to stress the second part of that sentence because science changes, and being current is one of the most important things that that you will hear. You need to be aware of when you're trying to spot whether something is accurate or not. But there's also a couple of other terms that I want to mention before we move on. And one of them, while misinformation is shared by people who may not intend to mislead others, there's something called disinformation, which is false information that's deliberately created and disseminated with some sort of malicious intent. There's another word that I think is really important to say here, and that's infodemic. And you may have heard about people who say we're in the midst of a pandemic and an infodemic. And when they say infodemic, what that means is there's an excessive amount of information about a specific issue or problem. So much information so that it makes it more difficult for the public to differentiate what is fact and what is fiction. So it creates this anxiety and confusion as people try to distinguish between evidence-based information and the vast range of unreliable information. So misinformation has been around forever. People, I know that you've all heard about people selling snake oil and trying to make promises about new ways to cure diseases and achieve eternal youth. But recently, misinformation has gained a whole new level of prominence. And I think it's probably because that we've had this perfect misinformation storm. There are three factors that have come into play in the past, I don't know, 5 or 6 years that have really made it a bigger problem than it would be in most other times. The first of those is the increase in social media platforms. So everybody who has a laptop or a phone has the ability to easily share information, any kind of information, good, bad, and everything in between. And they can share it broadly and they can share it immediately. Basically, everybody has become a newscaster. The second issue is the COVID pandemic. And the COVID pandemic created an environment, especially in the very beginning months of the pandemic. People were desperate for information. They were desperate to find out what to do, where to go, how to get it, whatever symptoms they have treated, what the cure was, what the hope could be. And the lack of solid information in the wave of this new thing led many people to try to fill that information void. So it just created this apprehension about medicine and what to do and how to do it. The third thing, which we're still seeing this every day in the wake of the election, is the political climate. It has been one of mistrust and divisiveness, and that has affected the overall sense of civility and trust in people about everything, not just medicine, but about everything. So I was at a meeting recently, and there were one quote and one story that kind of brought this point home to me. One speaker at this meeting on medical misinformation said, "Today, to state a fact is to take a side." And I thought that was absolutely prescient, because it is true. You can tell somebody something that is based on scientific evidence, but if they're on another side of the political spectrum, they may not believe it. And to kind of highlight that, there was a story that was told at this meeting about a pediatrician who was talking to this mom about vaccinating her children. And the mother replied to the doctor that she wasn't going to get her children vaccinated because she was a Republican. So I thought that was pretty telling. So I'm going to share some examples of medical misinformation these are the very, very, very tip of the iceberg. You open up Facebook, open up Twitter, and it's out there in abundance. But these are a couple of things that I wanted to share with you, just because I thought they were kind of interesting. These are headlines, or in some cases, they are first sentences, lead sentences of stories that are just kind of outlandish. Pennsylvania governor announces a law requiring individuals living in the same household to wear masks inside their own homes. Not true. California governor orders everyone except Hollywood actors to stay home to curb the spread of COVID. Again, not true. Researchers say coronavirus can be transmitted on 5G networks. Radio waves do not transmit virus. Ingesting garlic and hot peppers will prevent COVID. There was also one about drinking bleach. That would kill you. So that's not a good idea, but it's out there on the web and you can still find it. Then they try to put the voice of authority in there. Johns Hopkins research team finds COVID had no effect on US death toll in 2020. Well, that's not true. And then I love this one, neck gaiters spread the COVID virus. That was such a misinterpretation of a study that was showing the effectiveness of masks. And a lot of people were wearing those neck gaiters over their mouth and nose. And basically they found that they weren't as effective as a surgical mask or an N95 mask, but now all of a sudden they're spreading COVID. So those are just a couple of examples of the kinds of misinformation about COVID they'll never die because they're out there on these platforms and they've been shared many, many times. And so you can find all this stuff. Next, Adil, could you throw up the next slide, please? So memes are another big source of medical misinformation. Everybody loves memes. They're funny, they're whimsical, but they also can be harmful. And these are a couple of examples of memes that are clearly wrong, but they also, and even though they're kind of funny, they just give the wrong message and they make people feel like, the first case, there's a tombstone of somebody who was vaccinated, and the person at the funeral is an anti-vaxxer, and he's alive in 2024. So, the message is, I didn't get vaccinated and I'm still here and this guy did and he's not. So that's misinformation. And then over here on the right-hand side, there was a story or a rumor that was going around well, two different rumors, that the vaccine would inject magnets or metal into your body, or chips, these magnetized chips. And so this is somebody who obviously has metal things attached to the arms and the head sticking there because of this whole magnet thing. And it's sort of embarrassing that the New York Times, the Miami Herald, the Washington Post, all these papers ran stories trying to dispute the fact that, you're not going to become magnetic if you get vaccinated. And then Bill Gates was the subject of, so can you go back for 1 second, Adil? Bill Gates was the subject of so many memes, because he became involved in the production of vaccines and he was advocating for the vaccines. So everybody thought that Bill Gates was implanting chips in them and that he was the one who was going to, the devil incarnate or something. So he was out to kill people and all this stuff. So poor Bill Gates, well, no, not poor Bill Gates, rich Bill Gates, but he was the subject of a lot of misinformation. All right, now you can go to the next. So these are just 3 examples of things that are on social media. The first is a blog where they attribute information to the head of Pfizer research, who said, who is quoted as saying, COVID is female, or COVID vaccine is female sterility. So that came from a comment that he made talking about potential side effects of some of the ingredients within a vaccine. Nothing like this, totally out of context, but that's what was the headline, and that's what the message was that went around the world and back several times. And then on the left-hand side is a tweet from a person who said that she talked about a nurse in Alabama who was one of the first ones to get the COVID vaccine, who died 8 days later. And there were journalists who were looking into this, and they called every single hospital and public health centers. They could not find this nurse anywhere. This was just a made-up person who died apparently after having a vaccine. And then the tweet on the right is from Joe Kennedy, who kind of used his Kennedy name to spread a lot of misinformation about COVID. This was one example of many. Where Hank Aaron had gotten his COVID vaccine and was very public about it because he was hoping to send the message to Black Americans and older Black Americans that it was important to get vaccinated. He died several weeks after the COVID vaccine, and there were a lot of stories basically saying that he died because he was vaccinated. So this got a lot of attention, unfortunately. Let me see if I have any more examples. So one of my favorite quotes that kind of sums this up is, a lie can run around the world before the truth has got its boots on. It's so true. We all hear stuff, we just believe it, especially if it comes from someone we rely on, know, and trust. So that's why it's really important to understand what's misinformation, what isn't. How do you spot it? And if you think that it's something is not accurate or misinformation or disinformation, do not share it. I mean, that's the plug that I think the biggest takeaway from this is, if you are doubtful about something, or if you're not sure that it's authentic and accurate, don't share it, because that's why we're in this morass. All right, so how do you spot it? I'm just going to give you a few helpful hints, and they're all sort of pretty basic, but when you see something, don't believe it, don't automatically, even if it's cute, don't just share it. You need to check. You need to check your sources carefully, make sure they're reliable. You need to check the dates to ensure the information is current and updated. You need to check the motives of the authors or the information sources. Is there a conflict of interest? Are they selling a product? Are they looking, are they looking to make, to drive an agenda or something? Is there a kind of an ulterior motive? You also need to look at source materials, notes, and citations. A lot of misinformation doesn't contain anything that shows that it's valid. Is it from a peer-reviewed publication? Are there reliable sources who are being quoted, and are those quotes full? Is it the appropriate context? So you need to check the data and the evidence, and there are some fact-checking sites that we will tell you about at the end that can be quite helpful in figuring out whether something is true, partly true, or not at all true. And I love this. One method was developed at Northwest University Health Sciences Library. I love this name. It's a way to kind of think about what you should do to check check information, and it's called CRAP, C-R-A-P. Can you put up the next slide, Adil? And what it stands for is, and these are like a little tool to figure out, what do I have to think about when I'm looking at information? So currency, is it current? Is it timely? Is this something that, that has been updated on a website? Is it reliable? Are there sources and facts, and does it come from a place or a person who is reliable and can be an authority? And is this the source and authority on the issue? And what's the purpose? I mean, is this an opinion, or is this somebody who's trying to give you good information, or is this somebody who's trying to state a position, state a fact, or try to get you to do something? So, think about trying to cut through the crap and do that little test. And sometimes that would be can be a helpful tool to remember what questions to ask in your mind when you're looking at something. There's been a lot of interest in trying to get our arms around the problem of misinformation. And there's a lot of groups and a lot of agencies that are tackling this. It's become kind of a lead topic for the CDC, the World Health Organization. The National Academy of Medicine is, and their libraries very much trying to figure out how to deal with medical misinformation. There's a number of professional organizations, the American Medical Association, the Association of American Medical Colleges, the American Board of Internal Medicine, and the ABIM Foundation have tackled this in a big way. And actually the professional societies are looking to or are adopting policies and about their concern for the spread of misinformation, and some of them are taking disciplinary action when their members use their professional credentials to spread disinformation. So they're kind of taking a tougher and tougher stance because it's getting to be such a horrible problem. And even the platforms that spread social media have been grappling with what their role should be. So you've probably heard a lot about Facebook and Twitter and Instagram. I actually went to try to pull up some stuff that I had seen when I was trying to find examples of this stuff, and Facebook and Twitter had taken down some of the things that I was looking for. Well, they were very easy to find, but they weren't on those sites anymore. Google and YouTube have hired a person who actually trained at Mass General and has been involved in a number of very prestigious jobs to oversee an approach to medical misinformation that Google and YouTube are looking at. They're still sort of in the research phase. They haven't quite figured out what to do. But I think that there's enough people looking at this problem that I think we're going to see a kind of an all-out war on medical misinformation in the months and years to come. But nobody has yet come up with a magic bullet to prevent harmful misinformation from spreading. But there are some really good ideas bubbling up, and one of them is what Dr. Adil Akhtar has been working on. As you heard, he's an oncologist in Michigan who has heard his share of people who come in waving articles that they've printed from the web, and they want, this is a magic cure, and take shark cartilage or take megavitamins or whatever. So you can understand where his interest in medical misinformation stems from, but he's actually done more than just be upset about it. He has decided to try to come up with a solution. And so I'm going to turn the program over to Adil so he can tell you about what he's been doing lately.
Thank you, Peggy. Thank you so much. And thanks, Sharon and rest of the team. So as Sharon and Peggy introduced me, I'm a medical oncologist, so I take care of cancer patients. And in cancer, medical misinformation has been rampant for years, decades. Every time we see a patient, there could be some research done online, which may be misinformation, and patients are completely confused when they come and see us. So I'll give you, so one of the things which we should all realize is that medical misinformation is a global pandemic. We have heard about COVID pandemic. I think, as Peggy was saying, infodemic is probably even a bigger global public health problem. I'll give you a couple of stories, just real life stories, just to tell you how dangerous misinformation could be. So this is a patient of mine. About a month and a half ago, she came to see me. She had a curable early stage but aggressive type of breast cancer. So she was on newer medication called immunotherapy, where the drug starts to stimulate our own immune system to fight the cancer cells. Very effective in that kind of cancer patients. So she came to me and she was talking about starting herself on vitamin C intravenously. Now, just to give you an idea, if suppose the normal requirement of the body, say, is 500 milligrams, she was talking about 150,000 milligrams IV twice a week. So I tried to explain to her that it is not vitamin C only, it is a vitamin C plus the immunotherapy, and we don't really know what kind of an interaction can take place between the two drugs, because that aspect has never been studied. And number two, this is really mega doses of vitamin C. But she decided to go ahead with the vitamin C anyway, and now her liver has failed, and she may go for a liver transplant.
Wow.
Another example, I can never forget that patient's name. Another breast cancer lady, younger, had a newborn child, diagnosed with really aggressive type of breast cancer. I saw her and recommended doing chemotherapy first, followed by surgery, which is kind of a standard treatment in those kinds of aggressive cancers sometimes. And on insistence of her husband, she did not come back and started doing natural therapies. I did not know what the nature was, but she came back after 2-3 months, and the cancer had spread all over her body. And within the next few months, she ended up dying. So I've been suffering from medical misinformation because my patients have suffered from this evil. So 3 years ago, I started a healthcare writing program at Harvard University at Harvard Medical School. And as a part of my capstone project, I started researching different topics, and I became interested in medical misinformation. And from there, I enrolled into the master's program a year ago, and I continued my research into medical misinformation. And what I've realized that there is now a lot of awareness, but we still don't have a solution. And I'm not saying that there can be one solution, but when I started researching, I have come up with a solution. But before that, I wanted to share with you all a survey which we did to understand the behavior of consumers and patients online when everyone is looking for online information. So the first question that we asked, and remember, this is not a scientific study, it is a survey of random people of all age groups, all socioeconomic levels, and all education levels. So we've got about 237 participants in this survey. So the first question was, what websites do you currently use to look for medical and health information? And as you can see, majority of the people go to Google, and then through Google, they go to either WebMD or health system platforms like Mayo Clinic, Cleveland Clinic, and then the social media platforms. And social media platforms, as all of us know, are Facebook, Twitter, but of late, video platforms like YouTube and TikTok are also coming rapidly. Second question was, how much do you trust your healthcare providers like doctors to give you accurate health information? And majority of the people would trust their healthcare providers. Same question, but with nurses, about the same degree of trust on the nurses also. Maybe nurses are more trusted than doctors as a profession. Then, do you think that medical misinformation is a problem when you go and search for online information? And again, majority of the people think that the medical misinformation is a problem. And then the next question was, do you go and then try to validate the information which you get from the online platforms or the social media platforms? And majority of the people are actually going first, getting the information, and then going back for validation of the information. And when they go and for validation, they again go to Google, but this time they go to their healthcare providers and experts apart from the health system websites. So now we have 3 steps. First step is go online, go to Google, get information. Number 2, go back, validate the information. And number 3, go back to your healthcare professionals, doctors and nurses to validate the information. So can we combine all these three steps in one platform? So this is my capstone project for my master's program. And what my solution is that I call it MedRely, from reliable medical information, that we will consolidate all three steps of obtaining the information, validation, going to the healthcare experts in one platform. So in MedRely, the health information is created by healthcare experts, and then in the same platform, it will be authenticated and validated by a panel of healthcare experts, which will be aided by technology like machine learning and artificial intelligence. Also, on the platform MedRely, people can go and build communities and connect with each other and connect with the healthcare professionals, so that they can get engaged in two-way communication. So as a part of my original survey, we actually asked the people this question: if there was a new website where health experts provided authenticated, timely information that was peer-reviewed, meaning authenticated by other healthcare experts in the field, would you use it? And majority of the people said yes. So this is one of the solution. I don't think that this is the only solution, but I think I've presented the solution in front of different people, and there's a innovation lab platform at Harvard Business School called Harvard Innovation Lab. They have taken it on, and they think that this is a good platform which could be built and can sustain itself. So thank you for listening to me. Back to Peggy. Peggy, you are muted.
I think Adil was a little modest. He has been talking about this, spending a lot of time working on this potential solution, and the folks at the business school and the iLab there selected his project as one of several. I think there's maybe 8 or 9 or something, that they actually feel like there's some possibility that there could be some greater good that would come from this, or commercialization of some sort. So I think that was pretty exciting when they took this project on as something. The other thing that Adil didn't say is his daughter is a healthcare journalist for Business Insider, and is very interested in helping to make sure that the information that's put out there from reliable sources like newspapers and magazines and other places that people get information is accurate, and has become very involved in this project as well. She's a wonderful healthcare journalist, a very reliable, very respected one. So there's a lot of momentum behind this project, and there's also some potential partnerships. There's a lot of, as I had mentioned earlier, there are a lot of people who are looking at different ways to tackle this problem, and I think that there may be some really nice synergies with some of these groups that really want to do something, and an idea like this. But Adil is also going to start it with a very kind of a small subset. Like you just can't tackle medical misinformation and feel like you can handle it. So he's going to look at a small, kind of 1 or 2 things to really dive into and see if this is working. So some final thoughts before we get to questions and stuff. I just want to make sure that people understand that there's so much medical misinformation out there. You see it every day. You see it in advertisements. You see it on the things that pop up when you're going through whatever news site or whatever social media site. Don't be duped. be very wary of information. If it seems great, if it seems too good to be true, it probably is. Check it, type it into a search engine, look for reliable sources who can verify claims. If you don't take a drug, I mean, we were talking when we were planning this, we were talking about Prevagen and some drugs like that that are just all, you look at them and you think, oh my gosh, I can live longer, I can live better, I can think better. And talk to your doctor. Don't just say, oh my gosh, there's a jellyfish swimming around and there's probably something good inside that jellyfish that'll help me. You need to really check it. And I don't think you should be calling, a doctor or a nurse every time you see a commercial, but if you are thinking about doing something that could be potentially harmful or helpful, talk to somebody who can help you figure out whether this is a good choice for you. Don't share information. I know I've said that 6 times, but don't share any information that you're not sure about, because that's the problem. That's why medical misinformation is a problem now, more so than it was 20 years ago. And also, don't fall for the white coat and the stethoscope. There are a lot of ads. There are a lot of people out there who say they studied at Mayo or studied at Johns Hopkins, and they're giving bad information out, which is why these professional organizations are saying that if you are representing yourself as a member of our discipline and our profession, we are not going to, we're not going to let you continue in this role.
Peggy, there's a doctor named Dr. Marcola. He is one of the disinformation dozen. He's got millions of followers, and he's probably the #1 source of misinformation for COVID-19.
Yeah. And he's got an MD after his name.
Yeah.
So therefore what he says is probably true, right? Yeah. So you really do need to check facts. And the last slide that we have is something that could be helpful. And these are sources, places to look. That people tend to sometimes question, especially in this climate, agencies and institutions, but they really are the best sources of health information. So maybe you can't convince someone who maybe is very much, a MAGA Republican or somebody who believes in disinformation, that they should get their information from the CDC or the World Health Organization or a reliable source of information, but you can do that. You can do that for yourself. Those are the sites that you should look at. There's also a lot of professional organizations sites, the American Heart Association, the American Cancer Society, the American Diabetes Association. A lot of places have really good information, and they have more detail than kind of some of the more general sites. And then you can also see that we've included some fact-checking places there. There are some really good ones that could be helpful. There's one called Snopes. There's one called Fact Sparrow, and then there's Fact Checker. There's also when I was at this meeting that I mentioned earlier, it was the ABIM Foundation meeting that Susan Edgman-Levitan was nice enough to invite me to. They were talking about sites that appeal to different populations of people who may not have the kind of trust in the medical system that we would hope. So there's one that's specifically geared to Spanish-speaking individuals to check some of the information that's out there. And so I would recommend that if there are pieces of information that you think are wrong, that you're just not sure about, that sound too good to be true, run them through one of these fact-checking programs and see what comes up. So with that, I will turn it back to Sharon.
Nope,
or to Matt. Sorry, I didn't look at the agenda.
Yeah. One of you can stop sharing. Oh, perfect. Excellent. So this could not have come at a better time, as many of us are facing Thanksgiving dinner for the first time in a few years with people who may be from a different end of the belief and political spectrum. And one of the first questions, I think you alluded to it a little bit, Peggy, was on any suggestions on how to convince people of the truth when they feel all the accurate sources are biased. I think as I'm hearing this, the serenity prayer is going through my head. But I would love to get your thoughts on that.
Yeah, I think that it depends on the person. I mean, if this is somebody who's reasonable and is just really looking for good information and has seen this and you get asked about it, or somebody shares something with you that you know to be inaccurate or even dangerous, then obviously I think there should be some sort of an obligation to try to explain that that may not be truthful or accurate. And again, you can maybe check some of these sites and provide information and data, but that's the problem. To state a fact is to take a side. So I think it works on some people and sometimes, but in this climate, I think that you can't say universally, if I share some factual information with somebody, then it's going to be believed. But
Yeah.
I don't think it's a problem to try, because whatever we can do to stop the spread of all this misinformation would be helpful.
So Matt, can I just add something real quick?
Oh, absolutely.
So there are people who will never believe in truth. So a study was done. What they did, they divided people on Facebook as pro-vaccine, anti-vaccine, and people who are undecided. And they looked at all these anti-vaxxer sites. The anti-vaxxer sites were right on the top of the undecided people, while the true trusted information sites were all on the periphery. So the point is that the anti-vaxxer or misinformation people are well trained in social media and online platforms. They know exactly what they're doing, while we are sitting on the periphery trying to spread good information. We will have to train our healthcare professionals in the platform on the online social media websites.
I just wanted to add one thing. You made me think of this article that I was reading about engagement, and they were talking about this this site called herbs-info.com, and that the number of times that people looked at that was in the top 70, as opposed to the information that was entirely opposite on the Mayo Clinic site. They stated that vaccinated children are sicker than the unvaccinated. That was the headline for, and they were talking about the number of likes or how much engagement that site got versus the Mayo Clinic. So it's just, people are looking to these kind of unreliable sites as sources of truth in numbers that are just astounding.
I think one of the things we struggle with as clinicians is when a patient is taking something that has, unfounded claims, but they report great success with it. And that is often the physician in the room's challenge. It's, addressing the placebo effect. It's addressing the lack of evidence, and you feel like this killjoy, but at the same time, many of these things that fall outside of recommended medical therapies are not covered by insurance, are outrageously expensive, and not necessarily quality controlled and dangerous. I guess one question that also came up is, in this study, Adil, that you did, what was the study sample? And can you just give a little description of their demographics?
Yeah, so this was, again, not a very scientific study. It was an online survey done through a online platform called SurveyMonkey. The total number of responses was 237. And we looked at the demographics, like the age group, the education, the socioeconomic state, and it was pretty much evenly balanced.
Great. Excellent. Thanks.
And it was a random sample.
Wonderful. And then just MedReli, what does it stand for?
It's just a URL which I've proposed from reliable medical information.
Gotcha.
That's kind of my innovation.
Excellent, excellent. Well, fantastic. I think, you know, just to harken back to the very early days of our town hall, one of the main motivators for us to start doing something like this was exactly because of this topic. We are in a world that is now debating observable truth as not truth, but opinion. And it can be very challenging as we're facing complex medical conditions and, you know, whatever pandemic we might be experiencing. So it's been very lovely to be able to rely on the wonderful speakers who come with great renown and experience to speak truth to sophistry, I guess might be the phrase. So please, thank you for your work, and please continue. We're excited to hear how it goes.
Thank you.
So with that, we're coming to a little bit of a close. I want to thank everybody for joining. Especially, I'd like to thank our speakers, Adil, Akhtar, and Peggy Slasman. That was just absolutely, really a really great presentation. And we'll be seeing you all in December when we figure out what the next topic is going to be. And if you all have an idea, feel free. Don't enjoy the wonderful holidays upcoming. And if it is a political divide issue that might be facing you between the 3-bean salad and your dessert, it might be best just to let it slide. Thank you, everybody.
Thank you.
Thank you.